parts of patient-centered outcome research require very special individuals with research skills that are not those that we've traditionally used in our research for people with rheumatic diseases. These include things like individuals who can conduct focus groups and interviews with patients. This is not just people getting in a room, sitting and talking to each other, but it's actually analyzing the data that comes out of that using metrics to really identify what people are saying, what common themes are being identified, and how these things might link together in constructing a concept that we're trying to measure or trying to study. Also going individually to patients and doing interviews to find out what a patient thinks about when they complete a questionnaire, for instance, is really important. And these are the types of things that we haven't spent a lot of time or energy on up to this point. We also need researchers who are experts in developing outcome measures. It's not enough just to administer a questionnaire to someone that says, how bad is your pain on a scale of 0 to 100? But we need to figure out better ways to ask those questions so that we can get to what people really feel is important. I'll give you an example of this. One of our researchers was interested in understanding stiffness that people with rheumatoid arthritis experience. Doctors for years and years and years have asked patients the question, how long does your stiffness last in the morning when you get up? Feeling that this was a good symptom indicator of the amount of inflammatory disease activity that was present. But this researcher went back to patients and conducted focus groups. And she asked patients, what do you think about when you think about stiffness in your joints or stiffness overall? And what she found out is that patients actually can't easily answer that question about how long are you stiff in the morning, because it's hard to quantify the time, and it also doesn't always occur in the morning. So patients were actually somewhat challenged in terms of understanding even what we were trying to ask them. But when she started asking patients about what stiffness meant to them, she got a very different story. And it was not only the duration or the amount, but it was the impact that stiffness had on people's lives. That was the language that was universal with the concept of stiffness. Everybody could relate to that. So now her research is working to develop a new questionnaire for stiffness that will actually put the questions in the language that patients use to describe the symptom. We think this is really, really exciting research, and it's an example of what we have been asking is not the best way to ask that question.